Okay, we are recording and live. All right, let me share my screen and we will get rolling. Oh, okay, everybody see that? Beautiful, awesome. So welcome to our Advocacy in Action training. This is the training that we typically do each year as kind of like a preparation for our Advocacy Day. And it's just a way to talk through what advocacy looks like, how it can be applied, and then some really specific roles that can be used by advocates whenever you have meetings. Specifically, we'll be talking about meetings with policymakers tonight, and just some 5 key roles, just because everybody has a place in advocacy, and it's good to kind of have some roles to figure out where you fit best on a team of advocates and how to make a really effective meeting with policymakers. Oh, let's see. All right. So simply, the definition of advocacy, as I'm sure we are most aware, is a public support for or recommendation of a particular cause, or for us, that's particularly policies. So for North Carolina AIDS Action Network, we work specifically in HIV and hepatitis C policy advocacy. So anything that we know that the HIV community, impacted communities, hepatitis C communities, harm reduction communities need, we are at the General Assembly. And there's Rita, I'm going to let her in. At the General Assembly, or talking with county commissioners, or talking with Congress people about policies that advance our cause. So what that means for us is a chance to talk about and bring public awareness to issues that are important to you. And it can be a wide range of things. So I think when we talk about these roles, they can be applied to things outside of HIV and hepatitis C advocacy. These are things that you can use. That if there's anything that's going on in your community that you want to advocate for or make some change for, you can take these and use them in the future for other things as well. But specifically for us, it's to represent the North Carolina HIV and hepatitis C community and those impacted by the cause. And I think probably the most important thing when it comes to advocacy is you're putting a face to your cause. So often we talk about all these things that impact our communities and the changes that we want. But everything is kind of talked about in a vacuum, and we don't always have a face to a cause. It's just, here's the numbers, here's what we know, here's the numbers, here's what we know. So it's really important to put a face, and by putting a face to a cause, you're also putting a personal story or experience, so that it's not just some made up figurative, this could be what it is type of thing, but you're actually putting a real life face and story to a cause. And ultimately, it's to advocate for a specific change to make some kind of something better for your community and the people who are impacted.
Mm-hmm. I was just going to add that it's really important to put a face to the cause part, because regardless of whatever level of government you're working at, whether the federal level, state level, local level, there's so many things going on. There are so many other groups, so many other communities that have needs, that have issues, that are competing for attention. And if legislators are just looking at a bunch of papers, a bunch of data, a lot of numbers, that may not resonate with them, that may not connect with them, but they'll remember your story. They'll remember hearing about your experience. They'll remember your face. So that will allow the broader cause to be able to move forward because of your personal story. Go ahead, Matt.
Awesome. Yeah, storytelling is a huge portion of that, and there's a place in that in our presentation. So hold tight, because we're going to have a specific role for that. But there are a bunch of different types of events that you can use kind of this policy, this advocacy kind of toolkit that we have created. And they can take a lot of different forms. So that can be in press conferences, town hall meetings where you just gather with folks from your community to talk about specific policies, educational events where you're just talking about something that a lot of folks might not know about, panel discussions with policy experts or experts on your specific cause, media pieces, and most importantly for us right now would be meetings for policymakers. So thinking through some of this, what are some other ways that you can use advocacy strategies outside of this list? Does anybody have any other thoughts of how you can use strategies for advocacy?
I have one. So we're talking a lot about doing some work with DPS across the state. So they don't necessarily like make policies, but they definitely help determine how policies are handled and executed. So I think that would be an excellent way to do some advocacy, is by advocating with DPS for better DPS operations.
For sure.
Yeah, I mean, DPS, I feel like they definitely are in charge of making policies, but it may only be within DPS's purview. So it's like they have power, but it's like a unique kind of power. But it's important to know, for whatever your issue or cause is, who is the person that has power, or which is what mechanism or what agency or what group has the power. That way you're able to pick the right advocacy tool.
Can you use social media?
Yes, absolutely. Absolutely. Social media can be used in a lot of different ways. It can be used to educate folks on other issues. It can be used to facilitate conversations about issues. We've done that with Twitter chats. I've seen a Facebook Live press conference happen. I've seen a lot of things being streamed. And then that gets to be shared, and the use of hashtags and all of that. I feel like that's absolutely a perfect advocacy tool.
Yeah, especially in our current digital age, we've got to figure out new and inventive ways to do that. And so our typical meetings with policymakers, when we're not in a time of COVID-19 and social distancing, is in person. But these same strategies can be used for our virtual meetings as well. So in May of this year, for HIP Speaks on Jones Street, we'll be doing virtual meetings, and we'll encourage folks to use these same type of strategies for those too. So definitely can be used both for in-person events and for virtual events. All right, so now we're going to kind of break it down, because everybody has a place in advocacy, and we want to make sure that everybody is using their strengths best. Whenever you have these meetings with policymakers to talk about your advocacy strategy. So we have these key roles, and everybody can kind of find a place that they fit best in here. So the 5 key roles that we're going to be talking about today, and as we listen to these, kind of think through where you feel like you would fit best into this kind of list of things, and we'll go deeper into each one of them. But the 5 are introducer, storyteller, fact knower, note taker, and social media magician. And these are both for introverted and extroverted people. There are different roles depending on your personality type. So hold tight, here we go. All right, first is our introducer. So very simply, the introducer is the first impression that you're going to leave with whatever your audience is. So whether that's a panel discussion or a press conference or a legislative meeting, the introducer is the person who is going to kind of kick things off and get the ball rolling. Their job is to introduce themselves, introduce all of the members of the group, and then kind of be the introduction to what and why you are advocating. So for us, for like HIV Speaks on Jones Street, the introducer typically is someone who kind of spearheads the meeting and says, hey, my name is so-and-so with the North Carolina AIDS Action Network. We're here for HIV Speaks on Jones Street to talk about some HIV policy initiatives in the state. And with me, I have my friends so-and-so, 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 and so-and-so. And it's just that easy, that you are the introducer, and you have introduced everybody that you are in your group and your topic. Most important thing for the introducer is to be friendly, approachable, and be loud enough to be heard. Depending on these events, it can be a large group of people, it can be a small group of people. So sometimes you do have to have a more of a carrying voice, especially if you've got a larger group who's with you. And this role also works really well and naturally as a moderator or a facilitator. So as we go into these meetings, we know that policy experts love to hear themselves talk, or policy makers love to hear themselves talk. So they're not always experts. They are makers, but not always experts, because you are the policy expert. But they like to hear themselves talk, and often get off track of what you want to be talking about for your policy or your advocacy. So the introducer is a really natural person to kind of jump in and say, hey, yeah, I hear what you're saying, but let's kind of talk more about this to get you back on track as to what you really want to be advocating for if things go too far off the handles. So you'll also help redirect the conversation if it starts going astray, and then kind of get things wrapped up at the end if it seems like your conversation is going too long. Before we move to role number 2. So clearly, introducer is for our more extroverted folks. You can be an introducer if you're an introvert, but extrovert folks tend to do really well at this. Any questions about our introducer before we go to the second?
I would like to add that, the point about being a moderator or facilitator of the conversation really does come into play a lot, particularly around legislative meetings. Usually you have maybe 30 minutes. If you're, sometimes it's the 30-minute meeting. Sometimes you're lucky and you get a full hour. That's rare. But you have to take into account that there may be multiple people in your group. Sometimes that doesn't always happen. You're the only person, so you're playing all of the roles. So definitely pay attention to that. But if you're in a group setting, it is good to be strategic and to be able to have someone that is able to notice when the meeting is going off track. And that could be either off of your plan or just going in a really bad way, and to be able to help steer the ship.
Definitely. And yeah, so your meetings can be 30 minutes, they can be an hour, they can also be 5 minutes. So it's important to have somebody who knows how to direct that conversation to make sure that you are getting the biggest bang for your buck whenever you're talking about policy stuff, especially if it's like some of the meetings where you're chasing people down the halls of the General Assembly as they're in between meetings. Awesome. So second is our storyteller. And I just love this picture because I feel like this would be my cat if I had a hamster. So the storyteller is what I honestly consider probably the most important portion of your meeting, just because you are making something personal and telling your story as to why this is important to you. So your job is simply just to give a heartfelt description of why the subject matter is important to you and to bring your lived experience into the room. Just make it personal and be yourself, because that's what makes the story so impactful, is just who you are and why you care so much about what you're talking about. Depending on the type of event, the storyteller doesn't have to be the same person each time. And the story doesn't have to be the same each time. It can be, especially with some of these stories, when it comes to harm reduction, when it comes to HIV and hepatitis C, some of these stories can come from a place of trauma and can be difficult to share. They're extremely important to share if you are comfortable sharing, but they can also be a heavy burden and can be hard to talk about. So it's understandable if between meetings you switch between the storytellers to give each other a pause and really kind of account for that emotional toll that takes. But if you are comfortable sharing your story over and over again, then you can also be the storyteller for each meeting. One thing that I will say that I forgot to put onto this slide when it comes to storytelling, it's especially impactful whenever your story can relate specifically to the policy that you're talking about. So say you're advocating for, I'm trying to think off the top of my head. Say you want to talk about PrEP policy and expanding access to PrEP. And you are someone who is interested in PrEP, but is currently having trouble getting on PrEP, then you can talk in your story about the struggles that you've gone to try and get access, being refused from doctor's offices, or being told that you don't need it, or it's for so-and-so, or this or that, or this or that. So creating a story that does kind of tie into the policy is always really helpful. Also, some of these meetings are just kind of educational. You may not really get to the full policy ask, and it's more just bringing awareness to the topic. So that can also be a huge part of storytelling, is bringing a personal story to your topic just to make it real. And with that, it's important that, of course, this is real. A story is always more effective when it's real and can be related to. So it doesn't have to have frills and drama and lover that has been struck by lightning in the past. Just make it come from you and your life. It can be simple, but as long as it's real and relatable, it's going to be super impactful. So I think this is kind of like the meat and potatoes of your meeting.
Yeah, I agree with that for sure. I really do think that it's the most important part of the meeting, particularly for issues around HIV, hepatitis C, people who use drugs, because there's a lot of stigma, as you all know, around all of those issues. And that definitely carries over into, the legislative process. And, for folks to be able to put a face to these causes, maybe the first time that people, legislators have met someone living with HIV, or hepatitis, or, is an active drug user, and they'll be able to, hopefully, not always, have some more empathy for the cause as a result. So it could actually really be transformative for our work specifically.
Oh, I didn't mean to do that. Any questions about my slides. Any questions about the storyteller before we move on to our next role? Okay, awesome. And we'll have plenty of time for questions later. So the next role is, I think, kind of works hand in hand with the storyteller, and that is our fact knower. So this is the person who's going to know all of the numbers and the science behind the topics that you're talking about, kind of the data-driven person who can kind of follow behind the storyteller and insert some numbers. It's sad, but some policymakers are a lot more focused on the information and numbers than the personalization of our stories. Of course, your story is the most important part, and it's because it's what makes it human. But the fact of the matter is there are some policymakers that are a little bit more cold and are a lot more focused on the numbers. And what does it mean for money? What is it going to cost? How many people is this going to impact? What is it going to what is it going to take to implement this, and yada, yada, yada. And they need the cold hard facts. So it's good to always have someone there to back up a story with some facts and some numbers. And similar to the way that we mentioned that it's good that if the storyteller can kind of work hand in hand with the policy initiatives that you're talking about, it's really good to have a fact knower that's able to kind of work with the storyteller and be like, oh, you talked about this, and I have here is some data about X, Y, and Z. So for the PrEP user, I had trouble getting PrEP. I went to the doctor and they said I didn't need it, and I still need PrEP. Couldn't get it. And then this fact knower can come in. Did you know that in Wake County, this many people would benefit from PrEP, but this many people are currently on PrEP, and there's a huge disproportionate impact, yada, yada. So it's good to kind of work hand in hand with the storyteller and to get the facts with them. I think the most important thing with the fact knower is to make sure and I will say, I've got somebody's getting a little bit of feedback. So if you're not talking and could be on mute, feel free to unmute yourself whenever you want to share something, but I'm getting a little bit of feedback.
I have a question.
Okay.
Has there ever been a time when the fact knower did not know something and you all couldn't give them the information during your short period of time there? Do y'all ever have the opportunity to go back and provide them with the information that you do come up with?
Yes, that is a great question, and you are reading my mind, because that is literally the thing I was just about to talk about. So I think the most important thing for the fact knower is that make sure you're using actual facts and numbers, and don't ever make anything up, because it can always come back to bite you in the tush. And like Rita asked, or just mentioned, there are sometimes that policymakers will ask us very specific and direct questions that are kind of off the wall, and that most people would have no clue how to answer. So if that is to happen, don't make something up. You can just be honest with the policymaker and say, I don't know the answer to that, but we can try and get you that answer. So let me talk to someone else and we'll follow up. And so, yes, there are definitely those situations. And that's a really great situation, because it allows you to revisit a policymaker and kind of re-engage with them. So you've kind of laid the base level of talking about the advocacy topic that you're talking about. You've given a story, you've added facts where you could, and now they're more interested. They want to learn something else, and it's a chance for other folks to kind of come back in and say, hey, I heard that you wanted to know more about this, and I've got something to share for that. So I think that's a great question, Rita, and I think it's really important because it does allow for that kind of second opportunity to re-engage with those folks. Awesome. Any other thoughts on Fact Knower before we move along? Okay, great. So as you can tell, we have had 3 a little bit more extroverted type roles. The people who are going to be kind of talking and leading the conversation with policymakers. But now comes for our more introverted roles, which is where I tend to establish myself whenever I'm in these types of meetings. So the first one is the note taker, and I think everyone can relate to this little girl right now because this is how I feel most work days. When I know that I can't leave my house for the 11th month in a row. But the note taker is going to be responsible for keeping track of what's happening during your meeting. So you're going to, typically this will happen in the form of a document that we would provide you. So specifically for our advocacy day that we would provide. And it would just have some kind of key questions to help you take down some notes about your meetings. So it could be, what did you talk about? How did the representative respond to your conversation? Were they positive? Were they negative? Did they have a bunch of follow-up questions? Did they ask you anything, again, like we just mentioned, anything that you weren't able to answer? So that's kind of our chance to go back in and talk about it again. And so, just kind of keep track of how the meeting's going. It's important to be thorough and detailed so that we can know how things went and where we need to focus in the future. So again, that's where we can kind of see if there were questions that need to be answered. If somebody seems really particularly interested in one topic that we're talking about, then we know, oh, maybe they can be a champion for our cause, or vice versa. If it's somebody who is really negative, we can say, maybe we should avoid bringing them into too much conversation because they don't seem super interested, and maybe we don't want to have conversations with them in the future because they were a little bit harmful to our folks. So really important to include both positive and negative things about the meeting, and keep track of any follow-up so that we can stay in contact with those representatives.
Question.
Yes.
Have you all ever come across a senator or something that just blunt out told you, I'm not interested? We had this conversation last year. I haven't seen anything change. I'm not going to do this, or tell me something different that I didn't know from last year.
I have not had that happen with NC AIDS Action Network work specifically. Around House Bill 2, which was the bathroom bill, infamous bathroom bill from 2015, 2016, 2015 at this point, in a meeting with a representative to talk about the importance of repealing HB2 and how damaging it was. It was my current representative, by the way. He is not my favorite person in the world. I will just say it that way. And he said, "You're talking to the wrong guy." And that was just kind of where the meeting ended. And we knew that, we're not gonna engage with him anymore because there's no point in it. And he had a big sign behind his desk that was also transphobic. So we just moved along. But I mean, sadly, that does happen sometimes.
Mm-hmm. I've had mixed experiences too. I had one time where a legislator was fully educated on the issue. I think it was around HB2 as well. But they were just very much like honest about where their district was. They were in a very Republican area, and they're like, I support this personally, but my constituents won't. And so I didn't have to try to convince him about trans folks going to the bathroom. Like, he got it, but he was just also very much like, all right, well, next.
So you will definitely have that, but it's important to document that down just so for future reference, and we can kind of keep track of what goes on. So yeah, both positive and negative, just to make sure that we are keeping up with what your meetings are like. Any other note taker questions? Yep, go ahead.
So I love Rita's question. It made me think, have you ever interacted with any policymakers that may have stood really strongly on one end about something, and in the notes it said that, but then later on, as you're interacting with them in the future, it's like, oh, they're a bit more lenient, they're more likely to engage, or have you ever seen like a change?
Yeah. Yeah, I mean, and that always happens, unfortunately. And fortunately, I think that, you know, especially if they're making the move in the right direction, that's good. And, you know, that happened a lot around our advocacy around the syringe exchange program and legalizing those in North Carolina. When we brought that issue up to some legislators, they weren't really as familiar with the specifics around that, and they just thought it was just a place where folks did drugs. And so for us to be able to provide some education and clarity on what actually syringe exchange programs are and how they operate, we were able to change hearts and minds. But then there's been the other situation where, let's say around House Bill 918, which was around, you know, controlling if we're going to take kids away from birthing people if they have any sort of amount of controlled substances in their system. There, you know, was a legislator who normally is supportive of our issues who ended up switching their vote. That happens for a lot of different reasons. I don't think the person had any personal stake in it, but I think it was more like a political decision. So sometimes that happens where folks make politically expedient decisions that may not be in line with how they normally vote or values that they claim to espouse. So that's something you also have to watch out for as well. So that's why keeping these notes is important. That way you can be able to track, you know, specific people's records, how they are, things that are interesting to them. That way you know how to interact with them moving forward.
Yeah. And I will say, to go back to kind of like the positive change of mind, I think specifically in the work that we do, and not to like toot our own horns, but toot, I think that our organization and our community and our advocates work really well with people from all walks of life and all political ends of the spectrum. And so we're able to bring stuff in a way that people can kind of really personalize it and understand that it's such a broader issue than so many of the things that get polarized. And I think we've seen a lot of people who you would typically not think would be overtly supportive of HIV policy really switch to being really big champions of HIV policy. So it's important to have these conversations because you can change those hearts and minds and kind of get those people on your side that you typically would not think of. I always go back to a conversation that Lee and I had with a former representative in Pitt County. I won't name who it was. No longer is in Pitt County and is currently working in Congress. I'll let you deduce from that. But we were talking about PrEP and access to PrEP and how hard it was for folks, especially in Pitt County at the time, to get PrEP, and it still is in Pitt County. And he didn't even really know what it was, and he was a doctor, and we brought it up to him, and he said, oh, well, that makes sense. We should just put that in the water. So that's how you have those conversations that people are kind of like, oh, well, it's nonsensical to not do this. So, and that's also important. We like funnies too, so note takers should drop in little funny things that representatives say. Awesome. And then our final, which way? Come on. There we go. Our final kind of special role for advocacy is our social media magician. And this is simply just to make our online presence known by taking photos of your group, asking for photos with representatives or participants of whatever event you do, and sharing things that happen during your meeting with the virtual world. Because we are social media hungry people. And more than that, just to kind of document things, it's also important for folks who may not be able to attend an event or may not be able to get time off to to be actively engaged in your event, to kind of share with them what's going on and keep them in the loop, and let people know why advocacy is really important. Specifically with representatives, this is another way to really engage with folks on a deeper level and continue conversation outside of a typical meeting. So if you find out that your representative has a Twitter, you can engage with that person on Twitter and kind of establish a relationship with them that typically would not be there just with day-to-day conversation. So they love to take pictures and be posted on Twitter and show that they are talking with people and constituents. So this is a great way to engage with them. And yeah, just a really easy way to kind of let your advocacy be known more to the world. I will note that there's a little asterisk down there in case you can't read it. This role, I will say, typically is best suited for someone who enjoys and understands social media platforms. So like, no judgment if you are not that technologically savvy person and don't know how to work Facebook and Twitter, but maybe this is not the best job for you if you are not that person. No shame, no stigma, but maybe just defer to someone who's a little bit more comfortable. For example, I love Twitter. I am terrible at using Twitter, so I do not use the North Carolina AIDS Action Network Twitter page because it would be a hot mess if I did. Any questions or thoughts on our social media magician? All right. Quick kind of like recap and just some tips and tricks before we kind of break up and start thinking about some policy initiatives and how to practice. Of course, don't make anything up. If you don't know the answer, it's okay. Great time to come back for more conversation. Number two, sometimes these meetings don't go the way you want them to go, but it's okay to disagree and disagree respectfully. So if things go south, I think the best thing to do is just use my favorite Southern technique and bless and release and say, thank you so much. Have a good rest of the day and leave. That is totally okay. If something goes south and someone starts saying harmful things or stigmatizing things, it's okay to just kind of cut it and leave. It's important to prepare what you're going to say in advance and assign your roles and kind of make your plan so that whenever you go into these meetings, if something is to kind of go off the rails a little bit, you'll know how to recover because you know what's coming next. Of course, you can't script out these meetings. You're not going to say it's going to go exactly like this. We're going to talk about this, and then this person's going to say exactly this. But it's good to kind of have that blueprint so you know going in, like, this is kind of what we're going to try and aim to do, just so you can really steer the meeting in the direction that you want it to go, so it's not hijacked by the representative, frankly. Stay on topic and stick to your message. Remember, you are the experts in these meetings. These people are there to work for you and are not experts on HIV or hepatitis C or harm reduction or so forth and so on. So you take control of the conversation, and you can do this in a respectful way to really get your point across. And I think probably the most important thing is it's important to remember that policymakers and elected officials work for the people, and it's their job to listen to you. So like, don't be afraid to really tell them what's important and why this is important to our community, because everyone in our state has a place in advocacy, and these policies go so much further than just a piece of paper and a law and money that comes in and out of the North Carolina General Assembly. It's impacting real people's lives, and they are working for the people, and that is their responsibility to take these advocate stories and knowledge and put it into actual driven policy to make change. And I think Christina is now going to talk about our policy. Let me stop share. Okay, stop share.
Awesome. Yeah. So thank you, Matt, for setting the stage for what we're going to be doing now. We were going to actually review the policies that are of importance to our communities now, but we don't have time. We're going to go ahead and move into the role playing. So if you got that email from Deshay with the policy talking points, go ahead and whip that out. You're going to need that for your meeting. And yes, that's the one. Thank you. And when you look through that document, it's going to go through different policies that are important to the community, and it's divided up into different categories. So there's support for the HIV medication assistance program and other HIV related services. We have expand Medicaid and close the coverage gap. support for syringe exchange programs, and support for increased access for PrEP and PEP. And under that, it has some talking points under it, why it's important, the need, more information about each topic. So I'm gonna be playing the role of your legislators for tonight. And we have a couple of different characters in store for you. We'll see what happens with time, but hopefully we can get through at least maybe 2. So I'm gonna leave the room and Matt's gonna work with y'all for literally 2 minutes. 2 minutes to assign roles, and then we'll start our meeting. All right?
Okay, here we go. All right, so we've got I'm gonna jot down our roles really quickly just so y'all remember them. So we've got the introducer, we've got our storyteller, we have got our fact knower, if I can learn how to spell, would be great, our note taker, and our social media. So does anybody have a specific role that they feel like they would fit well into?
I've done a lot of moderating in the past couple months, so I'll happily be the introducer.
Wonderful. So we've got Deshay as introducer.
Thomas, Rita, Reese, what y'all want to do?
I'm storyteller.
Oh, Thomas, you're muted. Thomas, you're muted.
I said, since I had done it and all, and I was just going to let y'all get a feel. I mean, because I wanted y'all to be able to experience this.
So would you like to be, since you've got the knowledge, would you like to be the fact knower?
I'm not that, don't give me that much credit now, but I'll do my best. And if I can't do my best, I got Matt to back me up. We're a team in this.
Perfect. Not face knower, fact knower. Sorry. My fingers are moving too fast.
Oh,
And Reese, I know you're not feeling too well, so would you be open to doing note taker? That way you can not have to be too engaged, but like get a general feel and take notes on the situation.
Sure.
Awesome.
Okay, and we will be meeting with Senator Whitney Houston in 20 minutes or 20 seconds. And just to give you a little bit of a background in Senator Whitney Houston, she is from Pitt County. She is a former military individual, and she was part of the U.S. Navy. She has been at the General Assembly for 5 years and is a registered Republican. So just some knowledge for y'all as we go into this meeting.
What is the topic we're talking about?
That is up to y'all. What would y'all like for our focus to be today?
Rita.
Oh, you're muted, Rita.
No, I'm not.
Got the medication assistance program.
Okay, being HepC ambassador.
Okay, so hepatitis C,
General hepatitis C policy.
general hepatitis C stuff. Okay.
Okay.
All righty. Hi.
Hi.
Hello.
Who, what's going on? Oh, all right. Sorry, I saw this on my calendar. I'm not really even sure what's going on. Are y'all from Pitt County?
Some of us are, but not all of us, Senator Houston. It's nice to see you. Thank you for taking the time to see us today.
Of course.
I'm here joined with Thomas Cloudfelter, Rita McDaniel, Matt Martin, and Reese Cooper. And we want to come and talk to you about some of the HepC policies that we wanted to address. So thank you so much again for taking the time to talk to us today.
Before
Rita,
we start, I just wanted to know specifically who was from Pitt County again.
Reese Cooper is from Pitt County.
Oh, hi, Reese.
The rest of us are a bit more spread.
Thanks for joining. Just wanted to make sure I give some special attention to my people in Pitt County. Woo! But anyway, I'm sorry. Continue. What were you saying?
Oh, of course. We definitely want to have people who are serving represented in our talks. So, but we did come here today to talk about some of the HepC policies that we wanted to address, specifically around HepC treatment. And we had someone, Rita McDaniel, who wanted to share their story about why those changes would be so important to them, and how we and why those changes are important, and how we can go about working together to see if they can be enacted.
We'll see. All right, Rita, go ahead.
Hi, Senator Houston. How are you this afternoon? As I said earlier, and as I was introduced, my name is Rita McDaniel. I've been living with hepatitis C for about 10 years now. I used to be an alcoholic, and I've gotten clean. I no longer drink alcohol, but I don't have insurance. And I really need this treatment so that I can get my hepatitis under order. So that's why we're here, because I need you to support the Hepatitis C Ambassador Program. Thank you.
Okay, so you were saying that you got Hep C from being an alcoholic. Is that
Yes.
what happened?
Yes.
Okay. I'm curious to know why the government should be covering treatment for folks, especially if, you know, they kind of cause their own problem, right?
Well, that's true, but I'm going to turn it over to Mr. Codfeller, and he can give you some facts on why this is still important for those who used to be alcoholics.
Yeah, I mean, I don't understand like why because there's only so much money, you know? I mean, how are we going to pay for it? Hep C treatment, as you probably know, is super expensive, right?
But in the long run, it costs less to give me the medication than for you not to back this policy so that I can get treatment. Because if you have to spend time with me getting sick back and forth to the emergency room, days in the hospital, or it can even become worse. So.
Okay, well, you should probably have insurance to cover that. But Thomas, do you have something to say on this?
I agree with, first of all, thank you for having us, Senator Houston. And yes, you made an important fact there that when we drink, we do cause bodily harm to ourselves. But at the same time, we understand that. And we're not saying that it's nobody's responsibility to take care of us, but when we're in a situation where we're living below poverty, and I mean, yeah, we make decisions, but we're living below poverty, we can't get a job, or, I mean, our health is just deteriorated so bad. Cirrhosis of the liver, Hep C, Hep B. I mean, whatever the issue is, or whatever the chronic disease is, we fall into a category and a place to where we need help. And so with there being federal funding provided by the government to assist these programs, I think that what we're asking is there any way that you can take it back to the legislator and discuss it? Because there is funding out there to support this program. And we're just asking for some support.
Oh, I know there's funding. I just don't know if we need to be spending it on this. I mean, don't we want to open schools and give money to law enforcement? You know,
I think there's enough funding. I think there's enough funding to go around, though, that we can fund all of these programs, which is needed. And I agree with you, but I just think there's enough funding out there to fund all these programs. And this is a program that needs the funding because it's saving people's lives, even though they made a bad choice.
Thank you so much. This was so great. I actually have another meeting with some of my donors, so I will let you go. Can we get a quick selfie real quick before we bounce out of here?
Sure.
All right.
Awesome. Well, thank you so much for taking the time to talk with us today, Senator Houston. We know you're very busy, and like you said, you have your meeting with your funders, but we do want to find a way to support people who are going through substance use, so that they can have access to HepC, especially people who may be veterans. I know that you yourself were in the U.S. Navy, and a lot of veterans suffer from PTSD and may also be living with HepC. So this would also be an excellent opportunity to advocate with them as well. So thank you again for seeing us today.
Yeah, that's great. Veterans actually have veterans hospitals, so they're covered. But thank you. Bye.
Bye. How do we do, Matt?
Oh,
Christine.
Let's debrief.
let's debrief real quick. How did that feel? How did that go?
It went good. The only mistake that I can say is the Shay, he introduced all of us, but not himself in the beginning.
Mhm.
So he has to remember to do that.
I forget that every time.
Also, I didn't know how much time y'all thought you were going to be there. I mean, I feel like that could have been good to establish, like, all right, like, how much time are we spending here? All right.
So we can't always assume that if there's a 30-minute window that we have that complete 30 minutes.
No, it's ideal, but things can change, particularly on the state level. You can have the meeting scheduled and get there and they're all walking out the door because the committee hearing's happening. You're having to like walk with them to the committee hearing and that's your meeting, or your meeting gets switched to another time because of a vote that's coming up. So usually if it's on the schedule, you'll get the time allocated, but if there's other things going on, that could impact the time. So that's gonna have to impact your plan of action for your meeting.
So we should always check the scheduling to make sure that there have not been any changes before we get there or have our meeting or our Zoom meeting or whatever it is.
You can do the best that you can, but just be flexible and open to whatever is going to happen. All right. But I mean, did you think that Senator Houston was like a friendly legislator, a hostile legislator?
Go ahead, Deshay.
I would say she was an apathetic legislator that had other pressing matters on her agenda.
Mm-hmm. Yeah. She was a little mean too. No one's.
Yeah, I was gonna say you were being polite to see us, but you weren't really engaged in us.
Woo.
Exactly what Matt described in his presentation.
That happened.
Yeah.
You'll have folks, I've had meetings with folks that have started off really well. They were smiling and sweet and kind, and the meeting takes a turn and we have to bless and release and shut it down real quick because we start talking about immigration and then it starts going into rule breakers and those people, and then we have to shut it down because it's going to get bad. But yeah, I mean, sometimes that happens and folks are on the phone and folks are like listening and like not really paying attention and all of that. All right. Do y'all have time for one more role play? I know it's 7, but I feel like it would be good to kind of go through it one more time and work out any kinks. Is everyone good on time? Or what's everyone's schedule?
A little bit of time. I know there's that hemophilia thing I'm supposed to be attending tonight.
Okay.
And I only have a short window also,
All right.
because I have another Zoom meeting.
All right. So do we think we can squeeze another meeting in 5 minutes?
I can do 5 minutes.
All right. All right. So I'll give you 30 seconds to prep and then I'll come back, okay?
Oh no, where did it go?
Okay. What roles do we want to do this time? Thomas, do you feel comfortable being our storyteller this time?
Okay.
I'm gonna pretend that I know facts.
Great.
Deshay?
I can do note taker / social media
I'm
magician.
just not. Uh-oh.
If Reese's
I don't
willing
know
to
if
do
I should have been the storyteller or not, because
And then I will do introducer. And I think that we should probably, okay, we're going to be talking to Buncombe County Commissioner Taylor Swift in 10 seconds. And Taylor Swift is a Republican, 4 years as Buncombe County Commissioner, close ties to law enforcement with a healthcare background, used to work as a doctor in addition to being a county commissioner. So what do we want to cover HepC related in Buncombe County?
ooh,
we could talk about increasing
Safe.
syringe.
How about, safe syringe sites?
Save syringe sites.
I don't know nothing about syringe.
That's okay.
Is this in a rural county?
Buncombe County is in Asheville. You can just talk about, Thomas, that, so check your handout, Christina said in our little chat.
Yeah, because they offer more than just syringes, so they offer a whole bunch of things.
And we might not get.
I don't see anything.
If we don't get to a story, it's okay. We'll just kind of introduce ourselves and we'll figure it out. Okay, and scene.
All right, so welcome, folks.
Hi, Commissioner
Hello,
Swift.
how
How
are
are you
you?
doing?
I'm doing well. How are y'all doing? Thanks for coming.
Awesome. We're doing great. Thanks so much for taking just a couple minutes. I know you've only got like 2 or 3 minutes, but we just really quickly wanted to just introduce ourselves. So my name's Matt. We've got Deshay, Reese, Thomas, and Rita with us today, and we're here to just talk about some harm reduction advocacy that we're doing, specifically around syringe exchange programs in Buncombe County. So I'm gonna pass. So I know we don't have a lot of time, but wanted to just see if you had any questions that we could answer before you have to hop off, and then some follow-up.
Yeah, I mean, I'm curious to know if this is really needed in the community. I'm curious to know like why y'all are wanting increased support for syringe exchange programs. I'm just curious to know like what the need is and why they're important.
I'll go ahead and start. You all have a high rate for the county in which you live in and work and have served in of syringe use and overdosing. So it's important to, I know as you noticed by working in the health field that you've seen a lot of people come in through the emergency room that have overdosed. Mm-hmm. And there are a lot of ways that we can combat that by offering needle exchange, clean needles workshops, and naloxone that is needed too in case a person has an overdose dose that they can be shot with that, and hopefully it'll bring them back to life.
Okay. Question. All right, so I think that it's important to work on helping to end drug use. I'm curious to know if the syringe exchange program will actually increase drug use.
No, it doesn't. That's one of those fairy tale stories that the community or other people that are not knowledgeable have come up with. And so actually it decreases the spread of hepatitis C, HIV, and other health comorbidities.
So it's probably going to end up helping us save some money, actually. Oh. Okay. And I mean, obviously, from a medical perspective, it just makes complete sense, right? But some of my colleagues, fellow Republicans, may not care. But that money piece, we've been wanting to allocate some more funding to the police. So that could be great. All right. So I'm so sorry that I have to go. I actually have a police department appreciation lunch to attend. So I'm gonna go hang out with some cops, but thank you so much for meeting with me. Right.
Before you go, Senator or Commissioner, would you be open to taking a photo with us real quick, just so we can say that we had a chance to talk to you?
Okay. All right. Okay. All right.
Thank you so much.
All right. Thanks, y'all. Make sure you vote. Love y'all. Bye. So, okay. Quick debrief. What are your thoughts?
I love that Rita came through with the facts. She was like, I feel like you may not have a lot of time, so let's go ahead and hit you with these facts real quick. This is why this is important. This is why it needs to continue, and this is what needs to happen next. And I was like, okay.
Yes. You may plan for 30 minutes or an hour, but that may not happen. There may be a weird lunch that's happening that's going to get in the way of your schedule, and you just got to get those points out. So it was good that you were ready. You got straight to the point and were able to answer questions that came. What other feedback?
I will say I did. Commissioner Swift was a lot easier to talk to, more eye contact, more open. Granted, it was nice to hear that they brought up any possible opposition, but it wasn't as if, the opposition is sound and there's no breaking it. It was more like, well, there is some opposition, just so you know. And I said, okay, cool, thank you.
Yeah. So what insight did you get from your conversation with her? What information did you get? You were mentioning, okay, you know that there was going to be opposition potentially from other Republicans.
Yeah.
What else did you learn?
I mean, that was great to know before we go storming into their office and knowing that they may not, they may be blindsided to, I'm gun-ho, this is not what I'm going to spend money in or spend a lot of time into.
It definitely showed the priorities and like what the people of her party were focused on. They were focused more on the cost of things, getting drug use down. So yeah. All right, y'all. This was fun.
Thank you.
With the program, y'all are going to be working on advocacy and policy a lot more moving forward. So we're going to definitely do more of this specific activity and be able to do some more debrief and role playing. That could almost be its own session. So maybe we can do that at some point.
It'd be amazing. Yes,
Right?
I was going to say, if we could do some more of these role plays, that would be awesome.
It's really helpful to work out the kinks, in practice. That way, when you go into a meeting in real life and something weird happens, you're not like, oh my gosh, what do I do? You're just like, oh, I've done this before. Actually, we have lesson release because we're just going to shut it down. I learned that in my advocacy training, and then we're going to go.
You know what I've enjoyed about it the most, though? That it's being done and given to us by you and Matt, Christina. And I thank y'all for that. And I really appreciate it. Okay? Really. I mean that from the bottom of my heart. Because I know I'm getting it from the best. And I mean that from the bottom of my heart. Yeah.
Oh, y'all are sweet. Thank you. Thank you. Thank you. All right. Well, I had fun with y'all. Hope y'all have a good night.
Bye.
Have a blessed night.
Yes, you too. Bye, everyone.
Bye.